Thank you, Mr. Chairman. Thank you, Mr. Chairman Bernanke. I wanted to focus again on the health care issue that we are certainly grappling with right now. And of course, the cost estimates are all over the lot. CBO says there's no way this is going to lower the cost to government. And what we're concerned about, of course, is that the government plan then attracts more and more from the private sector plans. And I just wanted to ask you how you would assess another big government health care program, in addition to Medicare and Medicaid, that are already causing great concern for the future entitlements that will be required. What you think that does to debt, and is it the right approach right now considering our economy? And let me just add, the disincentive to employers to hire people, which is something that we're trying to do the reverse of right now when we have this high unemployment rate. Just give me your view of whether we should be looking at something different. Is there a problem here that you see on the horizon, looking at the big picture and the long term?
Thank you. There's certainly a number of issues that healthcare reform is intended to address, like access, like quality, and so on. As I mentioned to a couple of your colleagues, though, I think that from a broad economic point of view, an extraordinarily important one is the cost. We have medical costs been rising more quickly than the GDP for a long time now. And even under existing arrangements with Medicare and Medicaid and so on, estimates are that we will, in a few decades, be spending a very big part of the federal budget just to cover those programs. And so, well, I think there are lots of reasons to look at our medical system and try to find better ways to deliver health care to more Americans. I would urge Congress to pay a lot of attention to finding ways to bend the curve or to reduce the cost, particularly if the federal government is going to have a bigger share, because then the fiscal challenge becomes even greater. So if I could just propose that there be a lot of attention paid to how the program, however you look at it, however you choose to design it, find ways to either through consumer choice, through government choice, through however it's designed, to try to limit the so-called, to limit this ongoing increase that will really challenge our fiscal stability over a long period of time.
Does it concern you that CBO recently came out and said that it would, in fact, raise the curve, not lower it or bend it?
Well, I haven't looked at that in detail, and I don't have any specific comments on the CBO's analysis. But again, to reiterate, I think we should make an important part of whatever healthcare reform we do close attention to the implications not only for the fiscal expenditure, but also for the private sector, because the cost of healthcare affects businesses and households, even outside the government's budget. So addressing that cost issue, I think, is really needs to be a central part of the discussion.
One of the things that has been brought out is the Medicaid mandate and the cost to the states. And in my home state of Texas, it's estimated that it would add $3 billion a year to the state budget. And of course, that is also a great concern and being raised in all of the states with that kind of mandate on top of the struggling state budgets because revenue is down. Do you see that the mandate on Medicaid also is an issue that is going to affect the economy in the long term and the big picture?
Well, I understand the motivation and the objective of trying to cover more people and to help people who are not already covered by insurance. But not to sound like a broken record, but once again, the cost is the issue. And if governments want to add these costs, they need to think about where else they can cut, where else they can raise revenue, because we need to have fiscal stability, fiscal sustainability going forward. So as a broad measure, we need to think about how our government's fiscal picture will look, not just this year, but 5 years from now, 10 years from now, and make sure that however we choose to structure our healthcare programs, that we have a sustainable fiscal outlook.
Well, thank you. I think that one thing we're trying to do is just slow this down enough that we can find the information and have the best facts that we can. And setting an arbitrary August deadline seems to many of us to be very unwise, because so much could happen that would be irreversible if we really do change our healthcare system to this extent, with the costs and in a hard economic time anyway. And many of us are concerned as well that employers are going to be encouraged to just drop health care coverage, pay the fine, and let people go into the public system, which then becomes a bigger burden on the government, but also the beginning of rationed health care in many views. So I thank you for saying that we ought to be very careful before we do add more entitlements to our healthcare system, and I hope you will work with us as we are able to get more and more information about the real long-term consequences.